So when I was doing my residency in orthopedic surgery, I was really excited about everything in orthopedics. And people, I've talked about this before, but initially I was really interested in doing upper extremity. So that would be like hand surgery, elbow, shoulder surgery. I was really passionate about that. And I trained with some world-class guys doing that. Dr. Bill Levine, who is now the chairman of the orthopedic surgery program at Columbia. And then I trained with Dr. Louis Biliani, who's a legend in shoulder surgery. So spent a lot of hours with him in the operating room and just really, really enjoyed that. But as soon as I started doing my rotations in spine surgery with Dr. Mickelson and with Dr. Weidenbaum, I was just fascinated by how many joints there were in the spine, how complicated it was, how difficult it was to make the diagnoses. And it just fit my personality better because I love to solve very complex problems. And problems of the spine are, no offense to some, my other orthopedic surgery colleagues, but it is, to me, solutions for spinal injuries and conditions are the most challenging problems to solve. And I really enjoyed that, being able to solve those problems. And also, obviously, when you have an issue around your spinal cord or in your nerves and you lose function, it's critical to restore those functions in people if we can. So really enjoyed that. It was very clear as soon as I started doing spine surgery as an orthopedic surgery resident, I fell in love with it and never looked back. And so that's the same stuff that really keeps me motivated now. Now, having done it for 19 plus years, I'm going to hit 20 years here next year. No matter how much we practice, and I'll hit 10,000 surgeries next year, there's still so many mysteries of spinal surgery and treating those patients. It's more of an art than it is a science, something I'm passionate about. People are really struggling, and finding solutions to these complex problems are critical. And what I'm learning is the more experience you have, the more you've seen thousands and thousands of patients, the easier it is. Not easy, it's never easy. I don't want to use the word easy, but the more solutions we have in our toolbox to be able to help patients. And the reason experience is so important is because the more you see the things, and again, this sounds obvious, but the more you see things, the more you begin to connect. So sometimes we see patients that have very strange symptoms and other things, but because I've seen 300 patients that have had similar symptoms right away, I can start tying those things in. These are not things you can find in a textbook, right? It's more of an intuition. It's an art. It's understanding that. And then when I learn those things, then I can pass them on to other people and say, hey, have you thought of, doing it this way?